Thanks, Minister, for taking this quite important question. Minister, this primary care centre has been earmarked 10 years ago, and probably further. Myself and Deputy Warder have lived in that particular area, and the present health centre in Rolla is completely antiquated for a population of nearly 20,000 that live in North Clondalkin. So this has been earmarked for a long, long time, and even more than 5 years ago, there was 35 primary care centres around the state meant to be earmarked and done and completed. But at this moment in time, there is nothing done in relation to the Collinstown site. Now, from this PQ, there's obviously an issue in relation to the Department of Education and the HSE in relation to the transfer of land. Now, that may be the case, but the people that are being disadvantaged are the people that live in their area, and they need a healthcare centre as soon as possible. So hopefully you can clarify them matters. Thank you.
Deputy Minister.
Yeah. Good morning. And I would like to thank Deputies O'Brien, Ward, Kenny and Higgins for providing me with the opportunity to update the House on the position with respect to the transfer of lands and the provision of a primary health care facility at Collinstown Community College, Clondalkin. And I do want to acknowledge as well that there is unanimity amongst you here, and I appreciate that, and I appreciate the passion with which you speak and the absolute necessity for your constituents as well. The HSE has been seeking to acquire a site for a primary care centre at Collinstown Community College. The school site is in the ownership of the Minister for Education, as you're aware. Discussions have taken place with the HSE regarding the disposal of part of the site to the HSE for the development of this primary care centre. Discussions between the HSE, Dublin and Dunlera Education Training Board have been ongoing for a number of years, as you've outlined, and more recently with my own department. The initial proposal developed from an engagement between the DDLETB, the school and the Health Service Executive was that the HSE would construct a facility adjoining the primary care centre for the use of the school. The site for this development is separated from the main school building by an internal access road. Initially, this facility was intended to be a library, but it then evolved into a multifunctional space that could be subdivided if required. Following a review of the proposal by the Department in consultation with the HSE and the ETB, it was determined that the provision of additional facilities for the school, which adjoined the main school building, would be more effective and provide a value-for-money solution. The Department of Education has engaged with the HSE and the ETB concerning the delivery of the facilities at their revised location adjoining the school as part of the disposal agreement. Following further engagement with the HSE and ETB, I am pleased that it has now been decided that the disposal of the site for the primary care centre will proceed separate to delivery of the facilities to the school, and I think that's a significant positive. My department will proceed to progress the disposal of the site to the HSE in line with the protocols for the disposal of property sites between state bodies and subject, of course, to the sanction of the Minister for Public Expenditure and Reform. With respect to the additional facilities for the school, the Department of Education is currently in discussions with the ETB regarding the provision of these additional facilities for the school. The ETB will be submitting an application for the proposed additional facilities shortly, and this application will be processed promptly upon receipt. It is anticipated that the Department will be in a position to advise the school and HSE of the outcome of this engagement with the ETB very soon. Thank you.
Thanks, Chair. Minister, I do welcome the response, but it's slightly ambiguous. It still doesn't, give clarity in relation to, when this will happen. Because, we could have been talking about this 5 years ago, and the same thing would have happened. So I'm slightly concerned in relation to the ambiguous nature of your response. And I hope, because, at the end of the day, the people that will benefit are the people of North Clondalkin that badly, badly needed this. Because I would suspect, Minister, if this happened in a different area of Dublin, a more affluent area, it would be a different response.
Thank you, Deputy Minister. Your final reply.
Thank you. I want to be very clear, Deputies, there is no ambiguity here. And I think, to be fair, I've had a short amount of time myself to move this along, and I think it is a progressive and it is a positive step, and I think it should be acknowledged as such. that the disposal of the site for the primary care centre will proceed separate to the delivery of the facilities to the school, and that means that the impetus is there now for that to move ahead. And just in terms of the timeline, and I appreciate very much so for your constituents the issue of the timeline, I want to say that the department will proceed to finalise head of terms with the HSC for the disposal of the site. The department will also obtain the necessary sanction for the disposal of property from the Minister for Public Expenditure and Reform. And as in all property disposals, due diligence is required, and you'll appreciate that, and this can give rise to added complexities. Therefore, it is not possible to give a definitive time frame. However, I do want to say that the department can provide the HSC with the necessary licences to enable them to commence development work on the site pending completion of the sale, and I think that's fair progress also, deputies. So, and in tandem, my department will also process the application from the ETB for additional facilities for the school. So, in respect of both matters, I can confirm to you that officials of my department will endeavour to progress them and to expedite them as quickly as is at all possible. And I think that is significant progress for a project, both projects, I would say, because they have both been referenced, that are of particular significance to your constituents and the people that you represent. Gurmagad.